Good morning.
Good morning.
Do it one more time. Good morning.
Good morning.
All right, I heard it. Well, here we are. Our second day coming off of our work groups yesterday and our boot camps. And I'm hearing some good things about those boot camps. Who wants to share as far as what you got out of your boot camp? Just give me one gem that you got from the CMO boot camp, the HR boot camp, the board boot camp, the CEO, the CFO. I think the pharmacists were meeting as well. So who wants to give me a couple of gems? Share. Yes, sir. That's right. Everybody hear that?
In board training yesterday, we got learning reinforcement by playing Jeopardy, and the person who ran Jeopardy is the woman standing right up there. It was a great process and also a great session.
Great. Thank you. Who else? Come on, don't be shy. This is not a room of shy people. Got a bunch of... yes, ma'am.
We're going to use her slides to refresh our board when we get back.
Okay, awesome.
Good morning. I learned that we don't say equity anymore. We say limited variation.
Got it. All right. Okay, well, thank you for sharing. Anybody else want to share before we move on? All right, great. Thank you. Appreciate it. All right, so this is the day. We start our second day, and we all know that this is a very long day for you. Because after all, we bring you all together for the purposes of doing what you did yesterday, going to the reception, networking a little bit, connecting with some of your peers out there, also checking out the vendors and looking at some of the exhibits and some of the products and services that they offer. But then today is also a special day, but it's also a long day. It's a day where we get to recognize all of you by our various awards that we have. But then also, we're going to have a full day of trainings and technical assistance for you, and we've got a lot of good things on the agenda today. Before we go into recognizing many of you with these awards, I do have some housekeeping announcements. First, I want to let everyone know that these centerpieces, the flower centerpieces, and by the way, don't you love these centerpieces? Aren't these nice to celebrate 45 years? So those flower centerpieces, please take them home. Okay, they are yours. So please take them home. They're beautiful. We don't want them to go to waste. The other thing I was forced to do by my wonderful Chief People Officer, and he coaxed one of our board members, who happens to be a CEO of a health center for April, that I'm supposed to mention that Friday is HR Appreciation Day. So for all of you wonderful HR professionals, we will make sure we give you lots of hugs and kisses. And we do want to say thank you for everything you do. The other thing I'm supposed to remind you of is we have this raffle going, and I think you all can see some of the slides of the wonderful like to really keep it good. So we do have this raffle going on. So please make sure you are doing what you need to do in order to be a potential winner. Then also we've got the passport. You know, the little book that you had in your bag, right? It's an opportunity for you to go out there and talk with our exhibitors, get to know them and their products and services, but then also gives you an opportunity, if you get that book filled up, you will be able to be considered for some pretty fantastic prizes as well. I think we've got like an Aura ring and a remarkable electronic notepad and some pretty fancy things. So make sure you get that passport filled in. Also, CEOs and board members that are still here, we have a professional photographer here for the very purpose of taking some professional photos. So if you've been talking about the idea of getting your photo done or a new one, please go and have that done. We also have a makeup artist here who will help freshen you up, touch you up, so that you look nice and pretty for those photos. So please take advantage of that. And then finally, you all know we have this Food is Medicine program. And you know there's a lot of attention up at the administration now around food as medicine. So we think there's going to be some really good opportunities with this program and maybe some of your programs that you already have at your health centers. We've got Adrienne here. We have had some opportunities to speak to some of you all yesterday. She has. And so for those of you that have not had a chance to speak with Adrienne about the program, or to talk to some of your colleagues about the program that they're using through Adrienne at their health center, please take the time to do that. She's also got some contracts here, so if you're interested in the program and bringing the program on to your center, she certainly can sit down and have that conversation with you. Just so that you know, we are hoping that this program will be able to continue when we submit it. I can't remember, Jim, did we include the Food as Medicine program? We did. So for the Rural Health Transformation proposal, we did include the Food as Medicine program as an opportunity to expand it by potentially bringing on hopefully some additional folks. But then also the idea of maybe testing, piloting some programs with some specific health centers out in the rural area. More to come on that. So, I think I've done all my announcements. Am I good? Perfect. Okay, now the fun part. This is where we get to recognize some pretty special folks. Folks like you, folks that are you, working in our health centers and doing the things that you're doing. So, this is our time to do that and make that recognition. And it's both an honor and a privilege to open today's program by presenting our annual VCHA membership awards. Each year, we invite you to nominate colleagues prior to this conference so that we can exemplify the kind of excellence that is in your health center in regards to their service, their dedication, their commitment to advancing your mission and to helping the communities that we serve. These nominations not only recognize those individuals who go above and beyond, but also takes the time to show them that the work that they're doing is valued. And that it's valued by you, the colleagues, the supervisors, the CEOs, from the patients, as well as the communities that do receive these high-quality care coming from the health centers. This year, we were fortunate to receive an extraordinary, I'm telling you, it gets better and better and better, an extraordinary number of compelling nominations. It was in response to valuable feedback that we received from you all. Last year, when we told you that we wanted to rethink these awards, and we heard from you, and you helped us to do what we're doing with these presentations today. So we've expanded these awards to include some new categories. We're honoring excellence in dentistry, human resources, behavioral health, and leadership. Today, we celebrate the remarkable individuals whose contributions have strengthened our mission and inspired us all. It is with great pride that now we are going to begin these recognitions. So, our first award is for the Health Center Nurse of the Year. Now, do I have my hand? There's my hand. Okay. Our Nurse of the Year is Cynthia Fisher. Cynthia is a care coordinator and vaccine supervisor from Community Health Center of the New River Valley. Cindy leads with exceptional vision and dedication. She oversees a dynamic team of care and vaccine coordinators, ensuring that every patient who walks through those doors at CHC NRV receives high-quality, compassionate care. Under her leadership, Community Health Center of the New River Valley has achieved some of the top UDS performance measures in the state. One of her most notable accomplishments includes driving colorectal cancer screening rates from just 30% in 2019 to over 76% by the end of 2024. And that's a testament to her strategic approach, relentless follow-through, and unwavering commitment to improving patient outcomes. Please join me in congratulating Cynthia. Good job. All right, our next award is a new category, and that's the HR Professional of the Year. And it's my honor to present it to Rochelle Pashaw. Rochelle is the Director of Human Resources from HealthWorks for Northern Virginia. For the past 6 years, Rochelle has passionately led initiatives that focus a culture of appreciation, unity, and celebration, demonstrating her unwavering belief that the staff is the mission. One of her standout contributions has been the creation of HealthWorks Employee Advisory Committee, planning events such as the all-staff picnic and holiday party. Rochelle's dedication to creating a workplace where staff feel seen, supported, and celebrated has left a lasting mark on HealthWorks. Her work reflects the fact that she is a true champion of the people she serves. For the past 2 years, Rochelle has led VCHA's HR work group. Rochelle is quite often the life of the party and does a great job of keeping everyone connected. Please join me in congratulating Rochelle Fisher. All right. Okay, next up is Staff Member of the Year. And our 2025 Staff Member of the Year is Megan Doan. Come on up. Come on up. Co-Coordinator for Southwest Virginia Community Health Systems. As Community Hope Coordinator, Megan helps build a network of referral pathways with community partners, manages the health center's recovery and transportation services, as well as keeping the Behavioral Health Grants Committee on target with their goals. Among her many roles, she helps lead substance use disorder groups, drives patients to recovery-related appointments, updates work plans, educates staff on new policies, and plans community partner meetings. Megan is an employee that can always be relied on to be dependable and accountable for her responsibilities as well as help others with theirs. She goes out of her way to help patients with their treatment and ongoing recovery. Please join me in congratulating Megan. Okay, next is Volunteer of the Year. And this year, the award winner is Ellen Crawford. Board member for Health Work for Ellen is an enthusiastic, and I can contest to that, okay, and dedicated volunteer who represents HealthWorks on the board's directors and at community events throughout the year. Whether it's distributing information at health fairs, connecting with community partners, or lending a hand at special events, Ellen is a consistent and reliable presence, always advocating for access to quality health care for all. Ellen brings wisdom, compassion, and integrity to every space she's in. She provides thoughtful guidance, asks the challenging questions when needed, and always centers on the needs of HealthWorks patients in her work. Her contributions go beyond what's expected, and she's truly a partner of the mission. Please join me in congratulating Ellen. And that is Dentist of the Year. And this year, our inaugural winner, I'm proud to recognize Dr. Tareem Nasir, Dental Director from Capital Area As Dental Director of Con, Dr. Nasir has redefined what dental care looks like in a community health center. In the last year alone, she has led her team to provide over 4,000 dentist visits, many to the uninsured and underinsured patients who would have otherwise gone without. She's partnered with schools to introduce dental programs to reach hard-to-reach youth, catching cavities before they even start. She has recruited and mentored young dental professionals, helping shape a pipeline that reflects and respects the community that we serve. Under her direction, oral health care at Con has been transformed into a critical access point for overall primary care, particularly for low-income, uninsured, and Medicaid populations. Their contributions have not only enhanced access to primary care for the underserved, but has advanced Con's mission in tangible, lasting ways. Please join me in congratulating Dr. Nasir. person that we're going to recognize is our Behavioral Health Professional of the Year. And this year it is going to go to Bethany Brindle, Behavioral Health Director from Tri-Area Community Health. Bethany started as the Behavioral Health Director at Tri-Area in January of this year and quickly won over the well-established behavioral health team and her patients with the care and concern that she shows for everyone she encounters. She sees patients for the majority of her week and uses her administrative time to work on streamlining processes, recruiting providers and staff, and working with Tri-Area's school-based coordinator to provide behavioral health services to students in schools. She has been instrumental in her advocacy for a better work-life balance for the staff to reduce and prevent burnout by advocating for alternate schedules and a hybrid work option. She's a great addition to the leadership team and is able to bring the perspective of her years of experience in various healthcare settings to Tri-Area. Please join me in congratulating Bethany Brill. All right, next is our Provider of the Year Award. And this year, we are recognizing Dr. Margaret Stiles, Clinical Director of Eastern Shore Rural Health. Dr. Stiles could not be here today, but was presented with her award last week. So if I can ask you to just look at the screens.
Hello friends, Eastern Shore Rural Health is very super excited to announce that one of our providers has been named Provider of the Year, Dr. Margaret Stiles. You're probably thinking, why is Jeanette on video? She's right here with us. But Dr. Stiles this week was on vacation. Imagine choosing that over coming here. I think I would too. So we hope Margaret is on video or FaceTime and able to see this. Dr. Stiles is truly a gem above all. She has a calm and a very steady demeanor, as you can tell. But she's truly an asset to Eastern Shore Rural Health and our community that we serve. But let me tell you how she goes above and beyond as a provider. I want to tell two stories. If you all remember the H5N1 bird flu exposure last year, it happened on the Eastern Shore. We have 2 chicken plants here, and we got a call from the nurse at one of these plants that she felt like some of her employees had been exposed. So I asked if we could test them. Well, Margaret was off that day while our providers were tied up. So Joan Lincoln called Margaret. She willingly, on her day off, came in, saw the patients, but we didn't want to expose them into one of our centers. So she and Joan got together and brainstormed, worked out the procedure, called the health department, borrowed their van, and saw the patients. These patients that I mentioned were also Spanish speaking, so they had to work that in with translators. Well, knowing that this probably wasn't going to be our first call, they went ahead and had the van set up at our urgent care, so in case someone else came in, they were able to not expose them in the express care, urgent care setting, but at the van. The second story was about a young mother with 2 children that came, wanted to be seen out in the car, did not want to come in. Her house had been flooded, they lost all their clothes, the children were only in their underwear at that time, and Margaret went out there and talked them to coming in to be seen. Well, they had received a bag of clothes that the mother thought was infested with bugs. All their heads had been shaved. Getting them inside the urgent care, Margaret was able to call the proper authorities, was also able to get an aunt that was able to come in and take care of the children, and she was able to diagnose the mother with delusional parasitosis, only her 3rd was it showed not only an education for all the staff that was there, providers included, but also the compassion that Margaret has for the family and the children that were seen that day. Provider of the year. Yay, Margaret! And let her say a few words.
Thank you, Jeanette, and thank you to everyone here at this organization. I have to say, I started here after being in a true private practice for many, many years. It was quite a culture shock at first. And at first I was thinking, gosh, what have I gotten myself into? But I have grown to really love what we do. I take a lot of pride in what Rural Health does as an organization, statewide, nationwide. The mission is amazing, and I'm really proud to be part of that. And I really appreciate being recognized in this way. It means a lot.
Well, thank you, Margaret, for all you do. And thank you for nominating Joan, but also thank you for recognizing her expertise and skill for Provider of the Year. Yeah.
Thank you, Jeanette, for doing that. All right. Another category this year is Health Center Leader of the Year. I love this. And here, I'm proud to recognize Kayla Boyd, Chief Financial Officer for Tri-Area Community Health. Kayla has been the CFO at Tri-Area for almost 10 years, and she has a passion for her work and a greater passion for the patients. She has very close ties with the community and cares deeply about the people in it, patients and non-patients. As Chief Financial Officer, Kayla guided Tri-Area through one of the most challenging financial years in their history. During a time of uncertainty and fear, she worked tirelessly to ensure that the organization remained strong and stable. Thanks to her skilled financial leadership, Tri-Area was able to preserve both staff positions and vital services, ensuring that patient care was never compromised. And I remember those conversations with Jim. Among her many accomplishments, one of the most significant was her work alongside the CEO to successfully negotiate with CMS for appropriate Medicaid reimbursement and back payment, a crucial achievement that strengthens Tri-Area's future. Many CFOs are hesitant to spend money and like to say no, Michael Jackson. But if it will benefit patients and staff, she is quick to agree within reason. So please join me in congratulating Kayla. Our 2025 Special Recognition Award goes to Scott Kluken, Controller for Health Works of Northern Virginia. And Scott is unable to be here, so we are going to ask the CEO and the CFO to come on up and accept this award on his behalf. But let's talk a little bit about why Scott got this award. Scott plays a pivotal role in ensuring the financial integrity and sustainability of HealthWorks. He oversees all expense and revenue processing, manages receivables, and ensures accurate allocation and spend down of each funding source. He is also responsible for revenue recognition and timely invoice processing. Thanks to Scott's exceptional attention to detail and unmatched organization skills, HealthWorks is able to fully leverage every available funding stream. Through his efforts, HealthWorks has successfully launched new programs such as radiology and expanded access to dental care by opening an additional dental site, both of which significantly increase access primary and preventive services. Scott's dedication, accuracy, and efficiency provide the financial foundation on which HealthWorks' mission is built. He is the behind-the-scenes leader, if you will, that ensures that HealthWorks remains fiscally sound and positioned to grow, innovate, and serve those who need the most. Please join me in congratulating Scott. All right, so you all have heard me talk about why we have to have this data warehouse, right? So we can make sure that we are getting all the data that we need so that VCHA can tell your story. But tell it in a way that's both compelling as well as convincing, because we have the data to show your work and the work that you're doing. So this is where we get to recognize you in your outcomes. And remember, I know many of you, especially the CEOs, hear me say this, you've got to show it off. Show your good work off and spread it around. Because after all, we're going to recognize you for the good work that you're doing. So, that being said, we're going to focus on these next two awards, and it is to look at your outcomes. So the first award, we are going to recognize the health center for their A1Cs. And that health center, the way this award is structured is around UDS. We had 2024 information. We looked at the percentage of patients in each health center with unmatched diabetes. So we're looking at those percentage of patients with an A1C, right? That is less than 9%, okay? That award is given to that health center that reduces that percentage the most during a 12-month period. Yes, we are watching that on your behalf. This year's winner is Stony Creek Community Health Center for winning the A1C award. They went from 21.9% in 2023 to 13.6% last year. That's an 8.3% drop. So, do we have somebody from Stony Creek? Come on up. Lucy is the CEO at Stony Creek, and let me tell you, the work that they are doing at that wonderful little health center is just amazing. So Lucy, is designed to recognize a health center for dedicating their time, talent, and expertise to advancing needed initiatives that support the shared goal to improve colorectal cancer screening. Like the A1C award, we compared the UDS data from 2023 to 2024. And this year, the colorectal screening award goes to Southwest Virginia Community Health Systems. The colorectal screening award for Southwest, what we saw was that they improved their screening rates nearly 18% year over year. So in 2023, they were at 39.7%. To 2024 at 57.3%. And that's amazing. Typically, we only award one, but this year, it has been a pretty incredible year, as we all know. And these two individuals have done some amazing things on you all's behalf. Not only have they looked out for the best interests for Virginians, but they have been there when we've needed guidance, advice, perspective, and they give it to you, let me tell you. There are times when it's been uncomfortable, but they have helped us through it, and we felt we really needed to recognize everything that they have done for you all and for us to get what we've needed in order to advance the mission in Virginia. So, our first Torchbearer Award is presented to Colleen Ewan, Senior Health Policy Advisor to Senator Mark Warner. Throughout her career, Colleen has worked tirelessly, and I mean tirelessly, to expand and strengthen healthcare access for all Virginians. She has contributed to initiatives protecting patients with pre-existing conditions, improving access to rural health care, strengthening community health services, supporting prescription drug reforms, and modernizing care for chronic illnesses. Through her strategic insight, advocacy, and dedication, Colleen has helped shape policies that expand access, enhance patient safety, and promote a healthier future for communities throughout the Commonwealth. And here, we're going to take a look at a message from Senator Warner.
Hi, I'm Virginia Senator Mark Warner. It's an honor to be able to congratulate Colleen on being named a 2025 Torchbearer. For almost 4 years now, Colleen has been my trusted eyes and ears on healthcare issues across Virginia and at the national level. She works every day to expand and strengthen healthcare access for everyone in the Commonwealth. I gotta tell you, even when the Senate is in recess, when she gets around Virginia at a remarkable level. You know, she's personally visited healthcare stakeholders across Virginia to hear directly from them and you about their successes, from their struggles, and how we can better assist you guys. Her outreach is intentional, and her ability to make others feel heard and respected is admirable. In the office, Colleen is wit smart on the issues of the day. She is diligent and never afraid to ask tough questions, not only of providers, but also of me. It's been a real privilege working with Colleen, and I can't think of anyone more deserving of this honor.
Thank you. So, we're recognizing Colleen not only for her advocacy, but for her light, Torchbearer Award, her light that she has carried on behalf of so many. Colleen, it is with deep gratitude and admiration that we present you with the 2025 VCHA Torchbearer Award.
Good morning, everyone. Thank you so much for this honor, but the motivation to do this work really has come from you this year. The stories I tell across the Commonwealth about the Virginia Community Health Centers being the brave ones. Tracy talked about sort of the data in general, being able to tell your story, but it's been your bravery speaking up during the hardest time most of us can really imagine. And speaking up has given us the ability to fight for you all as much as we've been able to do. I visit your centers, I get incredibly inspired by the work that you do in the community, and I'm just grateful that you are here taking care of Senator's constituents and my neighbors. I appreciate it.
All right. So our next Torchbearer Award goes to Samantha Kohler, Senior Health Policy Advisor to Senator Kane. Samantha has been instrumental in shaping the Peer Support Specialist Act, a vital step forward in reducing barriers to certification and ensuring that peer support specialists can serve more Virginians in need. She has long been a strong advocate for community health centers, engaging with them to better understand community needs and to explore opportunities for partnerships. And she has carried the same dedication into rural Virginia, representing Senator Kane's office in conversations with CHCs, always focused on addressing the unique challenges that are faced by our rural communities. And right now, we're going to take a look at a video from Senator Kane.
Hey everybody, Senator Tim Kane here. It's my pleasure to welcome all to the Virginia Community Healthcare Association annual meeting in Roanoke. I wish I could be with you, especially to thank you for recognizing my wonderful lead healthcare advisor, Samantha Kohler, with your Torchbearer Award for all the great work she has done on health policy in Virginia and nationally. The Torchbearer Award is a prestigious one. I was really honored to receive it a number of years ago. I know folks like the Virginia Healthcare Foundation, longtime CEO Debbie Oswald, Congresswoman Abigail Spanberger have been recognized in the past. It's really, really a good idea to recognize and thank Samantha Kohler. As my lead healthcare advisor in my service on the Health, Education, Labor, Pension Committee, Samantha is just a whirlwind of activity, very productive activity. Whether it's battling for the Lorna Green Act to make sure that we provide mental health care resources to our frontline healthcare workers, battling on appropriations matters every year to make sure that even in tough times we're finding funding, traveling around the state to interact with our community health centers, whether it's hospitals, free clinics, or the federally qualified health centers, along with individual providers, interacting with our academic institutions who train the healthcare providers of today and tomorrow. Samantha is very, very grounded in the reality of healthcare in every corner of the Commonwealth and what we need to do to both keep away bad moves that will take us backward, but more importantly, advance on the areas that will take us forward. We've got our hands full over our objection. The Congress passed a reconciliation bill a few months ago that is already causing healthcare providers in Virginia to close, that is threatening hundreds of thousands with the loss of healthcare and creating challenges in our local economies. There's nothing more important to individuals than their healthcare and the relationships they have with healthcare providers. It's important in a challenging time like this to have really talented public officials who can go to bat for you every day, and you do not have a better advocate on the priorities that matter to you than Samantha Kohler. I'm enormously proud of her, very grateful that she is in her office, and truly, truly appreciate that you have chosen to recognize her with the Torchbearer Award. Thanks so much.
Samantha, your vision and commitment have strengthened healthcare access across the Commonwealth, like Senator Kane said, and it is our privilege to honor you today. Please join me in congratulating you.
Thank you so much, everybody, for this honor. I think many of you know that before coming into policy, I was a direct practice social worker, and one of my fears of leaving that work, which I love so much, was that I was going to miss the on-the-ground work, getting to directly interact with people that need our help every day. And I've been working in policy for a while now, and the thing that keeps me grounded and reminds me of the importance of this work is being able to work with you all. So thank you for all the work that you've done this year. It's been a tough year. Thank you for answering my many, many emails and questions, and like my 7 p.m. phone calls on a Friday night. I've definitely spoken to a few of you on the weekends about things that are going on. Just really appreciate all of you, and it's such a great honor to be able to represent you in the Commonwealth and to work closely with you all as Representative Senator King. So thank you so much.